Good afternoon, Black Health Matters family. Thank you for joining us all day and hanging in there with us all day. And this is like going to be the best session of the day. We have today, our session focuses on COVID-19 vaccine experience. So I know a lot of you have been waiting to hear from this beautiful, lovely lady. Today, I'll be talking to Nurse Sandra Lindsay of Northwell Health, and we'll be talking about the vaccine experience. So I know there's probably a lot of questions out there already. And I see someone who already said, yes, we have been. So we look forward to this session. So really, many of us have been affected by this pandemic in one way or another, whether it be losing a loved one, catching the virus ourselves, losing employment, not being able to socialize the way we'd like to, and also just the whole sense of normalcy being lost. We have all felt the effects of COVID-19. With the development of the COVID-19 vaccine comes a beacon of hope for some, but also a new layer of confusion for many others. The most effective vaccine for COVID-19 we're hearing right now is the Pfizer vaccine at 95% efficacy. But the issue is, while 4,237,143 people in the US have gotten at least one dose of a COVID-19 vaccine, some of us are still uncertain. And we truly, the Black Health Matters family, and I know you all don't know as well where to go and what to do at this point. So I have with me Miss Sandra Lindsay, actually Nurse Sandra Lindsay. She's the Director of Nursing for Critical Care at Northwell Health. Sandra has worked more than 26 years. She has a nursing experience and is widely known as the first person to receive the COVID-19 vaccine. And she's here in living color to share her story. So I'd like to welcome you, Nurse Lindsay. It's so great to have you. We commend you on your bravery, leadership, commitment, and care for humanity. You know, you've been out here on the front lines for many, many years, along with many other COVID-19 nurses, staff, healthcare professional, and we really love having you here today.
Thank you very much. It's a pleasure to be here. I'm so honored and humbled to represent millions of healthcare workers, nurses across the world. So thank you very much.
Oh, you're so welcome. And, you know, this has been really such a challenging time for all of us, you know, but some of us are curious, you know, what was it really like in New York during the height of the pandemic, you know, and in dealing with everything?
So Long Island Jewish Medical Center, where I practice, is in Queens, New York. And that was a bar that was severely affected by COVID-19. So some of my challenges were just dealing with the volume of patients, keeping pace with the volume of patients that were coming in, requiring our services. Working long hours was mentally and physically exhausting. Also, just seeing how this virus ravaged our communities and literally seeing people fighting for their lives. So many people fighting for their lives was very, very challenging for me.
Oh, I am, I am sure my heart goes out to you, and I can see even on your expression on your face. But really and truly, too, as it relates to the vaccine, what made you? I mean, we were all in awe. What made you volunteer to get the vaccine, and how have you been doing since you've had it? Because you're probably one that has the longest history right now.
So seeing what I was seeing coming into our hospitals and just hearing what was going on in the US and around the world, as a nurse, my professional responsibility is to preserve life. So taking the vaccine, I see it as a step forward in doing that. Also, as a leader in my organization, to lead by example. As I've mentioned time and time before, and this is my philosophy, when it comes to leadership, that I don't ask people to do anything that I wouldn't do myself. Personally, I was so scared of getting infected, infecting others, my friends, my families, strangers. My mom has comorbidities. I would feel very guilty if I infected her. Also for me, just ending up in one of my ICUs, I was so afraid. I went into work courageously, but I was very afraid. And I also wanted to instill public confidence, particularly among our Black and Brown communities, that this vaccine is safe and effective.
Yeah, and you know, it's still, we just still can't believe that we're dealing with this. But one thing, you know, we're all curious about, how did you talk to your family about this and your friends about getting the vaccine? What did they say when you told them you were going to do this, and what was their response?
So I've been such a fierce advocate for the vaccine, and since I heard it was in development, I would share with my friends and family about my daily life at work, so they could have an understanding of how challenging and how difficult it was just going to work every day and seeing everything that I was seeing. So I was a fierce advocate from the beginning, and everyone in my family knows that I am focused, and when I set my mind to something, I am going to do it. So I've been sharing with them that I cannot wait for this vaccine to hit the market. I will be wherever it is being offered. And having a brother in healthcare, we talked a lot about this. And I remember saying to him this Sunday night when I found out that the vaccine was coming to New York and I was going to have this opportunity to get it, that, hey, I'm getting the vaccine tomorrow. And he goes, oh, cool, I can't wait to get mine. So, you know, we didn't think anything of it, that I would be here addressing people today and sharing my experience. We just saw it as, okay, the vaccine is here, long awaited. We need this. This is our best defense against this virus. And I'm going to take it. I shared with my son the morning of, hey, I'm going to get the vaccine, just like any, you know, ordinary day, except now I'm going to have this extra protection.
Wow, you must have really been talking to them for a while to get them convinced that this was the right thing to do.
This was the right, and so they can't wait. I took my mom last week to get her vaccine, and you know, she did great like me, no side effects except a sore arm. So, you know, it's just been great.
Yeah, and that's one of the things, and some people are worried. We hear stories about after the first vaccine, they're fine, and then the second one, there's some other, you know, some people feel like there's some complications. So tell us, which vaccine did you receive, and how did it feel to get it? And were you in any kind of pain?
So on December 14th, I received the Pfizer vaccine. The day after the vaccine, I had mild soreness at the site, no different from I get when I get the influenza vaccine annually. On a scale of 1 to 10, with 10 being the worst soreness, it was about a 1. No fever, no feeling of weakness, no headaches. I felt fine. As a matter of fact, I was up at 4 a.m. the next morning. I was invited to speak on some morning shows. And so I was up and out the door to be at the studio at 6 a.m. After the second vaccine, similar, no side effects at all. Although some people have experienced mild fever, weakness, but nothing that Tylenol, Advil, ibuprofen, and some good rest and lots of fluids won't take care of.
Yeah, and so that's a good thing to add, because in some cases, individuals feel like they may need to take like a Tylenol or something before vaccine. Is that something that's recommended, or how do people, because there's so much fear, a lot of people think that in anticipation of pain, they need to go in and get some medicine in advance. What's the protocol?
So Tylenol people have reported is effective, or anything you take for pain normally is effective. And that pain, that soreness that you feel at that site pales in comparison to the pain and suffering of getting COVID-19. And those inflammatory responses is normal. It's saying that your body is building up antibodies against this virus and the vaccine is working.
Well, that's, that sounds really great, but we still have a situation where there's so many people of color that are hesitant to getting the vaccine. What do you think we would need to do to make people become more open to receiving it, other than getting more vaccines out there, of course?
The first thing we need to do is to listen to people and to assess why they're hesitant, because people are hesitant for different reasons. Some of you, as you mentioned before, are hesitant because of maybe the side effects, what will happen after I take the vaccine. And so they're scared about that. So if that is the reason, then, we share some of the side effects, what to expect and what to do about it. For people who are staunch anti-vaxxers, we still need to speak to them as well, as they may change their minds. We have to be open to everyone, being culturally sensitive. For people who quote historical events, then it's educating them on some of the safeguards that have been put into place, some of the safeguards around this development of this vaccine, which have been put into place to ensure that it is safe and effective. And for people with just plain conspiracy theories and inaccurate information, that we take the time to present facts. And we have to keep talking about this and educating people in languages that they can understand. And also to rally up our leaders, or formal and informal leaders, people that the communities trust, to help us to disseminate the information and to get our communities on board with realizing that this is really killing us. It has affected us significantly more than any other population.
Right. And so as you talk about safeguards, and I see a question in here about vitamins and deficiency and those kind of things, building up your immunity, are there things that people can do in advance of getting the COVID-19 vaccine to help build up their immunity so that they will also be able to not only take the vaccine, but do well just overall against any type of virus?
So overall, just even, taking the vaccine out of the situation, we all need to, practice preventative health by taking care of our bodies, exercising, getting rest, eating well, going to our visits with our physicians, and speaking to our physicians about things that are affecting us, so we can get them taken care of early, so we don't have these comorbidities that, when that coupled with COVID-19, is just a recipe for disaster.
Yeah, and so as you talk about comorbidities, is there something that we can do in terms of convincing people that do have these things, to trust the system? Should they go to their doctor and talk to them about getting the vaccine? Is there, what type of advice can you give to those individuals that have that?
So I want people to know that prior to me taking the vaccine as well, I did my homework. I spoke to my physician. I did my research into finding out, how is this vaccine being made? What is this new technology, which I want people to know is not new. It's been in existence for a while. So getting yourself educated, talking to people that you trust, And when you don't understand something, ask them to break it down to you so that you understand it, so you can be informed before just saying, I am not taking the vaccine because it was developed too quickly and I don't trust it. To get informed.
Yeah, definitely. That's one of the things that we hear all the time, people saying that it was too quickly. Do you have any idea of some of the protocols you could say that were in place that to help, you know, people's understanding of, you know, the fact that it wasn't quick? We know that it was spent billions of dollars on this. Share with us some of those protocols.
So with vaccine development, typically, there's a weakened form of the virus that is being used. And this time, that is not the case. It's not using a weakened form of the virus. And using a weakened form of the virus can take years because this is done in a factory, in a laboratory. This time around, your body's actually acting as the factory. So that cuts out a lot of the years that it would have taken. In developing a vaccine also, there is funding that needs to be procured and so much logistics that typically takes years. And that's why vaccines take years to come to market. But in this case, this is a global crisis. And so much efforts globally were put into place with this vaccine. Every energy from around the world, all the resources to bring this to market. And so things that used to take years now take months, things that took months took weeks, and things that took weeks took days and hours to bring it to market. But I am confident that none of the safeguards were bypassed just to bring a vaccine to market. And I just want to commend the people who participated to go into this study so that you and I can have this vaccine today. I don't think we give them enough credit for, you know, risking, we may say, their lives for going into a study, not knowing what to expect, so that this vaccine could come to market.
Yeah, you're so right about that. So I think what we'll switch to right now, we have quite a few questions in the chat. So I'm just going to go ahead and, you know, share some of them here. So one of them is, should we have antibody testing after receiving the 2 doses? If so, how long after the second dose?
So I have not heard anything from the experts yet about requiring antibody testing after, just to see how much antibodies we have and say a time frame. I have not received any antibody testing since getting the vaccines. I had prior to and did not have antibodies, so I know I didn't, and I've had several COVID-19 tests, so I know I didn't have it. But so far I haven't heard any recommendations about getting antibody testing after getting the vaccines.
Okay, very fair. So this next question is, do you know at which time in the clinical trials was immunity confirmed?
That I don't know, I'm sorry.
Right, and then we have, let's see, there's a question here about Black people experiencing a low vitamin D deficiency. And we do know that that's prevalent with a lot of people. Can you talk about that a little bit? I know it's not necessarily related to the vaccine, but it could be.
So I myself have a low vitamin D rate. I do take vitamin D supplements. And I don't know how that is affected with COVID-19, how it's correlated or associated with COVID-19 and the vaccine. I would suggest speaking to your physician to get some advice on that.
Mm-hmm. And so here's one. I've read that it's possible to contract COVID-19 even after you are vaccinated. What are your thoughts on this one?
So it is possible. And actually in the study, in the group that got the vaccine, I think it was around 8 or 9 participants out of that 20,000, over 20,000 participants in that group that actually contracted COVID-19. But the difference is the severity of illness and the potential for death after. So the experts have said that you can catch COVID-19 after, and that's why you still need to wear your mask and practice all the CDC recommended guidelines, but it decreases your risk of becoming severely ill and possibly dying from COVID-19. So even after vaccination, you still need to wear your mask and practice social distancing, meticulous hand hygiene until, again, the science advises us and guides us that it is safe to not do so anymore.
So here's another one. Have you seen or heard of any patients hospitalized after COVID-19? If so, how many? I know you mentioned some other people during the initial stages, but maybe just recently in the last, I would say maybe 6 months, have you heard of any or 3 months, have you heard of any hospitalizations?
Patients that are still coming in with COVID-19?
Yeah.
Oh,
no, patients that actually have had the vaccine and then had to be hospitalized afterwards.
No, I have not heard that.
Okay. And let's see here. Some people are just, I'm just looking through the questions. So one question here, and I'm not sure if you'll be able to answer it in terms of, because I'm looking at it myself. What are the scientists saying about the long-term effects of taking it if you can still catch it? I know it will lessen the symptoms, but what will happen within 5 or 10 years from now?
So that is hard to say, and only time will tell. It's a new vaccine, and so we will continue to see a lot of studies being done about this, and we will learn more about it. You know, I don't know what will happen in 10 years or 5 years, but I know what can happen in 10 hours or 5 hours if I get this, if I get coronavirus. So I weigh the risk and the benefits, the now versus 10 years from now.
And here's an interesting question. Has the vaccine been given to any children? And then how young could they be to receive the vaccine, number one? But with children with any underlying health issues, and is that recommended?
So the study, the Pfizer study wasn't done using children, and that was one of the concerns with one of the reviewers. I remember she was a pediatric physician, I believe, and she had concerns about, you know, the vaccine being approved and for it to be given to children since they were not a part of the original study. So I don't know of any children that have received the vaccine, and that would have to be studied before I think clear guidelines can be given on that particular for use among children.
Well, I know that we could probably go on with this session for another hour or two because there's so many questions. I'm sorry that we have to end here, but I want to thank you so much, Sandra, for giving us this time, and thank you to Black Health Matters family out there for your questions and comments. Is there any parting words you'd like to share with us?
So first of all, thank you so much again for having me. I want people to know that the virus is still active. It is still out there. So I encourage you to be careful. I encourage you to get informed, get vaccinated when it's your turn. Healthcare workers, we courageously go into work. We're doing what we need to do, and we're fighting hard for you, but we need your help. We need you to help us. We're in this together, and together we can do this. So each one help one. We're here to help no matter what, but if you could help us out by getting vaccinated, practicing according to the CDC guidelines, which are based on evidence, and take good care of yourselves. We would appreciate it.
Well, thank you so much. And thanks everyone. I hope you enjoyed this session, and look forward to you joining us for the wrap up here in a few minutes. Thanks, and see you later, Sandra. Thanks
Thank
again.
you. Bye-bye.